I am here with Dr. Laleh Gharahbaghian with Stanford Health Care with the latest on the COVID pandemic. We're talking about a new study of California's hospitals showing what we've heard about Omicron. It's causing fewer hospitalizations and shorter stays. What do we know about that?
It's a good question. And it was an interesting study done out of Kaiser, studied about 70,000 patients. So a pretty good powered study. And it did show a decreased hospitalizations and length of stay for those who get Omicron. However, that largely is our population that's largely, thankfully, vaccinated. And it still showed that those that are most impacted by Omicron still continue to be the unvaccinated. And those that are in the vulnerable population, even if they're vaccinated, specifically those who are older than 65 or who have heart and lung disease, and it can still impact them quite a bit. That's not to say that hospitalizations are lower. I think all of us who work in the hospital in this area were already at or over capacity before Omicron even happened, and how fast people are getting it. The number of people who are getting it, the number of people who are needing testing, and of course, the number that still remains unvaccinated, they're all getting it in such a quicker amount of time because of how highly infectious it is that our hospital systems are working under disaster conditions.
Wow, you're talking about the sheer numbers of people getting it. A lot of people feel like it's nipping at their heels if they haven't already gotten it. And some just saying at this point, hey, I might as well just get it over with and move on with my life, get those antibodies. How do you feel about that?
That's not the way to think about it. COVID is not something that you want to get, even if it may likely be Omicron, because that's still the majority of the variant that's happening in our area right now. The reason is because sometimes it feels like a mild cold. Other times, for people who are vaccinated, and some of my colleagues who have gotten it, who are vaccinated and boosted, it doesn't feel that mild. They feel pretty awful. They have severe body aches, they have fever, they have headaches. It really runs them down for quite a bit. The other thing is that when you get it, you have to quarantine. It does impact your life. You can also spread it to others, which we don't want to do. And if you spread it to the vulnerable population, the older, the very young, or those who are immunocompromised, they get it pretty hard. That includes those that are not vaccinated. So try to avoid getting it at all costs. We still don't know what long COVID means. You can still get long COVID with the Omicron variant. It's still being studied. And that's something that's debilitating for many months. So don't get it. Get vaccinated. Try to protect yourself. Stay physically distant. Wear a high protective mask and be safe.
Let's talk about those masks. Now it's the N95, the KN95 that are being recommended for everybody. How long can you use one of those before it starts to deteriorate, get a little bit less protective? Because I know a lot of people have them stuffed in their purse, a lot of people like me, and you're not really thinking about how long you've been using it.
You know, there's not a specific number of times or number of days. What matters is how long you've worn it, whether it's soiled or wet or dirty, then you want to dispose of that right away after that. And that could be just after a single use, depending on how you've worn that N95. And if it's not a tight seal around your face, it's the time to discard it. And on average, it can be used between 3 to 5 times. Us healthcare workers, we don't feel comfortable using the same N95 after a single full day, given our exposures and everything that we deal with at work. So sometimes people who just use it to go to the grocery store and come back, which is maybe about 30 minutes to an hour of time, they could probably use it for longer as long as it's not soiled and it fits well.
Okay. Now, what about the vaccines right now? I know the information is always changing when it comes to the level of protection. We've heard some new stuff about Pfizer's vaccine, specifically when it comes to Omicron.
So what's good to know is that the studies of the current vaccines is that against Omicron, it is still pretty highly effective, up to 75% highly effective against symptomatic infection, and even higher against serious illness, hospitalization, and much higher against death. What Pfizer and also Moderna is doing is that they are creating a Omicron-specific vaccine. Pfizer says it likely is going to be ready to give out around March, which of course is going to be after the peak. We're hoping the peak, as projected, will be in the next week or two of Omicron cases. And it's always good. That's the benefit of mRNA vaccine technology, is that you can pretty relatively quickly adjust the vaccine in order to tackle what is of current interest and what's the current pandemic and the current variant.
Yeah. Well, and the worry on that is the next variant going to already be here by that point?
It might, with more people that continue to not be vaccinated around the world. We are the hub of international travel. Then it's inevitable that we're going to have another variant that comes in just the next few months.
All right. Well, we will keep following it. Thanks for your expertise, Dr. Laleh Gharahbaghian with Stanford Health Care.
Thank you for having me.